So there's two ways of doing FUE. One is fully shaven method and one more is partly shaven method, where we shave the donor area and in the front we do not shave because of the downtime. Some people are working, they cannot afford the fully shaven downtime. My preference when I do this procedure, I always advise my patient to go for a fully shaven FUE. So today, my patient here is doing a fully shaven FUE. So we have completely shaved him. Doctor have just marked the donor marking. This donor area is a permanent zone and is a safe zone area. This is typical male pattern baldness. His brother has hair loss, his father has hair loss, his grandfather too had hair loss. So this is a hereditary problem. So in a hereditary problem, male pattern baldness, the patient can lose hair from node 1 to node 7 of male pattern baldness. So if we look at it, so I cannot extract the grafts around this area because this is not a safe zone. Meaning to say, in 2 or 3 years time, he may lose this hair too. That's why it's so important that we need to know and recognize where is the safe zone. So this is the safe zone that doctor is reassured that dihydrotestosterone receptors cannot recognize the hair around this area. So now, if today's plan is to take the hair from the donor area, that is the safe zone, and we harvest, extract and we plant in the front. Meaning to say that hair will stay with him because it's not affected by dihydrotestosterone receptors. However, remember this, that he has a lot of mineralization hair here. In time to come, let's say he does not take any medication, can this hair be dropped off and not be there? The answer is yes. He has to maintain it by taking medication, or if he goes into progressive hair loss, which is very obvious, he has to come back to do another hair transplant. So that's why one hair transplant may not solve your progressive hair loss as time goes by, because many patients may want to take the medication for a short while and after which they stop their medication because of the side effect, or maybe they're so tired of taking everyday popping in medication. So sometimes patients come in to do a second hair transplant just because they have gone into a progressive hair loss after doing the first hair transplant. So if you see, this is the donor marking. Why the donor marking has squares? The donor marking has squares because we plan the number of grafts that we want to take in each boxes. So we don't simply take, randomly take. So we planning, this is called how we plan when we do a procedure. We harvest 500 here, 500 here, maybe 400, because the density as you go upwards to the parietal area, it becomes less and less. So we have to have a nice planning. And if you look at it, so when we do the shaving, we actually has more visible eyes to see where exactly he has lost a lot of hair. So you can see, so doctor has marked in different angles. Doctor has marked it so that later it becomes very easy for me to know where exactly where he has more hair loss and where it's a little bit. During hair transplant, the distribution of the grafts plays a very important role, and that lies in the hand of your hair transplant doctor. So this is how it is now.